Across the board, your chances are worse as a woman with heart disease than they are as a man. You're less likely to have your symptoms recognized, to get early testing, to have effective surgery or medical treatment. Heart disease is highly preventable, although 62% of women have not talked to their doctor about prevention. The Cleveland Clinic's Leslie Cho told us the best strategies during a recent visit.
1 in 2 women die from heart disease. 1 in 8 women die from cancer. And yet every single woman over the age of 40 gets mammogram, gets pap smears, that get pap smears starting at the age of 18, whereas women really don't get any preventative assessment for their cardiovascular disease.
As a woman, you do have one enormous advantage. Your heart is protected by estrogen. But when estrogen production slows at menopause, your risk triples, and hormone replacement won't help.
For years, people thought that hormone replacement therapy would be beneficial for women in terms of preventing heart disease and stroke, and actually it turned out that it was not beneficial at all, that it actually may cause increased heart attack and stroke.
Prevention is straightforward. 90% of heart attacks come from traditional risk factors, which your doctor can determine at your next visit with a thorough history and physical and a few simple tests for total cholesterol, blood sugar, and blood pressure. Here are several key steps undertaken at the Cleveland Clinic, a nationally ranked center of excellence. First, diet and exercise have a very powerful effect on reducing the risk of heart disease, stroke, and diabetes. Second, ask your physician if aspirin is right for you.
Where aspirin was beneficial was women greater than the age of 65 who are postmenopausal. So for those women, low-dose aspirin, which is 81 milligrams of coated aspirin every day or 100 milligrams every other day, was beneficial for reduction of heart attack and stroke.
Third, consider cholesterol-lowering drugs if diet and exercise don't get your bad cholesterol, or LDL, below 100. Statins decrease your risk within weeks and when taken properly are safe.
Patients don't want to take statins for many reasons. There are lots of patients who are scared about taking statins because of the possible liver side effects, possible muscle side effects. Now, those are very rare and uncommon.
Number 4, raise your good cholesterol, or HDL. Considered as important as lowering the bad.
There are certain things we do to our body that lowers good cholesterol, and those are smoking, gaining weight, and eating foods that are high in trans fat.
Exercise and the prescription form of niacin can raise HDL up to 30%.
There is no other drug currently on market that is safe for patients that raises good cholesterol as well as niacin.
Number 5, review over-the-counter medications with your doctor.
Vitamin E has been shown time and time again to have actually a detrimental effect on cardiovascular health. So if you're on 400 international units of vitamin E, which is what's in a vitamin E capsule, it actually may increase your rate of death and heart failure.
Work with your doctor on other risks by discussing diabetes and blood pressure management, and smoking, often the greatest risk of all.
I think women tend to, even after they get diagnosed with cardiovascular disease, they tend to get less aggressive treatment, and they also tend to get less aggressive treatment outside the hospital as well as within the hospital.
Controlling your risk factors is a highly effective way of decreasing your chance of a heart attack substantially. Aggressive treatment may help slow, stop, and even reverse the course of your disease.